constitution of this new board?
Well, I don't want to get involved in assessing the individuals that have been appointed, but they need to have the commitment. They need to be people of integrity, and they need to be people that have time to actually do the work that they have been appointed to do.
Thank you very much, Vitus. Vitus Azim is Executive Director for the Ghana Integrity Initiative, and we've been speaking on, well, issues that have to do with the reconstitution of SADC board by President John Dramani Mahama. Now, TB cases recorded in the Dade Kotopon municipality dropped from 157 in 2012 to 142 in 2013, a situation health authorities are not too happy about. So the District Health Directorate is expected to record and manage more cases this year in order to reduce TB infections in the communities. The TB focal person for the district, Amelia Delakbodo, revealed this at a special training for TB community outreach volunteers organized by Concern Health Education.
Health facilities in the Dade Kotopon municipality coordinate with the District Health Directorate, but only 4 are actively involved in the management of TB. That's detection, investigation, treatment, and post-treatment checkups. I'm told 142 cases were recorded last year, but authorities are expecting to record more cases this year because they tell me that there are a lot of undetected cases in the municipality.
Before one goes down with TB, the person would have lived for the germ or the bacteria for some time. And these are all in the community. So we want to pick them up early. So we are going to put a lot of strategies in place, or we have already started screening every client, every person that enters our facility for any reason. People in close association with our patients, we screen all of them. We screen our HIV patients. We also screen our pregnant women.
The TB focal person explains treatment of the disease, which used to last for more than a year, has now been shortened to 6 months.
The first 2 months, we call it the initial or the intensive phase, where the person takes 4 tablets, but it's a fixed dose. So you have 1 tablet, but you have 4 different medicines put together. The person goes on to what we call the continuation phase, which takes 4 months. If the sputum test was positive at the beginning, we are expecting that at most by the end of the 5th month, the person should have finished, should have converted negative.
The community outreach program run by the Concern Health Education is playing a key role by helping detect cases for early treatment. Last year, 30 trained volunteers went into the LA communities, detected and referred 20 cases to health centers.
The whole program is to refer cases that are hard to reach within the communities to the health centers and do a supervision to make sure they complete their direct observed treatment, which is the DOT for short course, so to speak.
How well trained are these volunteers?
We've taken them through the various basic symptoms that every individual can understand. They are not doing clinical care. All what they are doing is to identify presumptive TB cases and link up with the TB coordinator.
Health experts say TB is curable and treatment is free. The public is encouraged to report to the hospital if they experience chronic cough, chest pains, as well as severe sweating at night. Family and friends are also advised to support patients undergoing treatment.
According to a survey conducted by the Ministry of Health and its stakeholders, 4,000 tuberculosis cases were undetected in 2013 alone. The situation has been attributed to failure by patients to seek early and appropriate health care as a result of the misconceptions, myths, and stigmatization associated with the ailment. Most of the patients of these undetected cases are said to seek help from spiritual institutions such as churches and spiritualists. Isaac Ampoma is president of the Concern Health Education team, and he's joined me here in the studio for a quick chat. Thanks for joining us here.
Thank you very much.
Let's start off with the cases in Dade Kotopon. What did we identify as the cause for the seeming outbreak in Inla?
Well, TB, of course, is an airborne disease, and for that matter, majority of the community members are unaware, and the lack of information is as a result creating that sort of a delay in bringing the cases to the hospitals. So most often the various households are not well ventilated, and for that matter, a disease that is being spread through coughing, it can easily spread, and for that matter, everybody living in the community becomes potential TB suspects. For that matter, most often the understaffing of the health system also creates a problem to go into the community to sort of encourage them to come and pick their treatment. For this reason, the civil society organization within the coalition of NGOs in health, and for that matter, the Stop TB Partnership, is being encouraged through the Global Fund funding package to go into the community and help bring this treatment closer to the health centers.
And of course, that's why you've trained your people.
And it's in this reason that Concern Health has decided to be part of this movement.
I'm worried about the fact that in 2013 alone, several thousands of cases were undetected. It means that we don't really know the signs of TB, do we?
Not so much to say, but I think it is now time as a country for us to also look at the potential and the benefit of community volunteering. You know, most often we want to rely on expertise, but not all the time. I mean, health system and healthcare is a collaboration of all. Optimal Health is a collaboration of all. So when we realize the need a community volunteer can do to the health system, then of course we can begin to train more volunteers to give them basics, techniques to go into the community to bring the cases for us.
But naturally, if you know the symptoms of TB and you felt that you were having more than 90% of that symptom, you'd go to the hospital. However, on the other hand, if you don't know it, you sit at home and perhaps you'd keep medicating, spreading it, exactly. and going to the wrong places to seek help. How would we identify if you could be a potential TB carrier?
Yeah, there are various myths surrounding the disease. In the local dialect, some call it in Samanwa, what have you, and whatnot. In the early days, thank God, with the proliferation of NGOs working, this myth has been reduced. And I believe it is time for us to encourage people not to stigmatize, because TB treatment is free, and therefore going to the health facilities, you don't pay anything. It has been subsidized by the Global Fund. These are some of the information we need to tell them. And volunteers has been trained nationwide.
So before your volunteer gets to a particular community, I know now they are very stationed in Ladade Kotopong.
Exactly.
Right. So for instance, you're outside Ladade Kotopong and you're coughing. Is that a sign of worry to go to the hospital immediately?
No.
I mean, 4,000 cases undetected, that's huge.
Indeed, it is alarming. But like I said, most often we rely on the expertise of health practitioners. I think it is time for us to begin recruiting community volunteers. You know, volunteers work with passion, and when you have them, it helps to increase case detection. And
Very well. Very well. Thank you very much, Isaac. Isaac Ampoma is with the Concern Health Education Project team. Now, here